raises on those stocks. Anyway, our extensive coverage of the health care debate continues with Republican Congressman Michael Burgess of Texas, who says the Senate finance bill still leaves millions uninsured. Congressman, I just had the CEO of Blue Cross Blue Shield on with me, and we were talking about the uninsured, and he said yes, the uninsured absolutely impacts their business negatively. By 2019, under what we see right now out of Max Baucus and the Senate, still leaves 25 million Americans without insurance in 10 years. Still.
And that figure is a little bit of a shock when you see the other side of the equation, how much the cost is for the coverage provided. This thing has been the subject of discussion all year. We're down now to the 5 products produced, 3 in the House, 2 in the Senate. But boy, doesn't it still look like we're pretty far away from some kind of an answer here?
Not only far away, this is Adam Shapiro, by the way, Congressman, and I'm curious because you have the Speaker of the House now talking about absolutely insisting on the public option. You've got some of the senators, Sherrod Brown, I think, is leading this out of Ohio, insisting that the Senate include a public option. It looks as if the Democrats are going to get that put into some kind of legislation, but is that going to wind up killing everything?
It could. Certainly on the House side, which is where I sit and where I have the most familiarity, I think you're reading the tea leaves exactly right. The 3 bills passed out of committee are now being consolidated, rewritten in the Speaker's office. There's a heavy input from the White House, as I understand it, and I have to believe that the bill that we will likely have the last week in October will have the public option remaining in it. That will make it unacceptable to a lot of people on my side and a significant number of people on the Democratic side. I would question at this point if they even have the votes on their side. They're not likely to attract many Republican votes by following that track. And then, with all due respect to your previous guest, a mandate, does that really belong in a free society? Is it even allowed under the Constitution? You ought to be able to construct a system where the products are ones that people want rather than ones that people are forced to buy. And that is really, to me, that's the big, what we've missed in this discussion is how do we get the coverage for the people who need it? Can we accomplish these things without restricting people's personal freedom? At one point on the Senate side, they were talking about putting people in jail if they didn't buy insurance. That's a pretty tough deal for a free society, isn't it?
And fining them, Congressman, but also in the plan is putting these levying billions in fees to folks like my last guest and to medical device makers and insurance companies. So not only, yes, if everybody has to get health insurance, they have to buy health insurance. Sure, an insurance company would benefit from that, but on the other side, you're going to charge them $8-9 billion as well, basically an extra tax on insurance companies. So, it just doesn't seem like it's really working out to be a fair shake for these businesses, which do employ thousands of Americans, tens of thousands of Americans.
And cover tens of thousands of Americans, millions of Americans, and your previous guest was quite correct in that if it wasn't for the cross-subsidization of the private sector, the existing public sector it doesn't pay for its own freight right now in any hospital or doctor's office across the country. If we see a patient under Medicare, we understand that we're going to have to charge a little bit more from a private patient in order to make up that difference, because Medicare does not pay the cost of delivering care, and in most states, my state in particular, Medicaid is nowhere near the cost of delivering the care.
And that's what we've been told by several CEOs, as I mentioned earlier. Have you sat down and actually met with the administration on any level and had some open face-to-face talks, Congressman, about health care reform? Do they want your opinion?
Well, I will tell you, going back to just after the election, I did meet with members of the transition team at my request and said, look, I know this is going to be a big deal next year. I want you to know that I didn't give up a 25-year medical career to come sit on the sidelines. I want to be consulted. I have ideas. There will be plenty of times that we disagree, but let's keep the dialogue open. They thanked me very much for my interest and enthusiasm, and that's the last I saw. I also reached out to the chairman of my committee, who was new at the time. Henry Waxman had just been replaced John Dingell. Same discussion. He thanked me for participating, and again, last I heard until we got the bill in the committee for markup in the summer. The president did ask a number of us down to the White House in March, but that was a photo op, just like the doctor's visit last week. We were just purely a backdrop.
And you were a doctor. And you were a doctor. I mean, so you've actually got a. Oh, sorry.
Still with us.
Sorry.
I'm licensed. I'm licensed, but not insured right now. So.
But I mean, okay, so tort reform. I got to ask you real quick about tort reform. He paid lip service to it, but there's nothing in this current plan about it that's specific. Does that bother you at all?
Yeah, it bothers me greatly. In Texas, we've actually done some good things in the arena of tort reform with caps on non-economic damages, and we've seen good results since 2003 by doing that. I introduced an amendment that essentially would provide a Texas-like compromise nationally, and first I was turned down on a technicality, and I was turned down on a party line vote. And that's really unfortunate because, okay, the doctors were at the White House this week. We're asking the doctors to be our partners in this brave new world of healthcare that's going to be developed, but we're not willing to give them a smidgen of relief on the number one thing that's driving the costs up in practices across the country, and that's the medical liability premium and the cost of defensive medicine, which we in turn pass on to our patients and to the government of private insurers.
Congressman Michael Burgess from Texas, thank you very much for coming on Fox Business, Mr. Burgess. And again, you look great.